So here we have test question. Pause the video, take a few minutes, read this test, guess which answer is correct, and after, let's discuss this test step by step. So it's 50-year-old man. He complains on fatigue and right upper quadrant discomfort. Right upper quadrant discomfort typically is a feature of liver or biliary pathology. He also has diabetes type 2, for which he takes metformin. And we always have to keep in mind that the major side effect of metformin is lactate acidosis. Because of this, metformin is contraindicated in kidney failure. His body mass index is 38, which is extremely high, means that he has obesity. On physical examination, he has hepatomegaly. His AST is 115, which is high, and ALT is also elevated. For us, it's crucial to determine which enzyme is elevated more. In this case, the elevation of ALT is higher than elevation of AST, which means that it's not alcohol that caused liver injury, it's something else. So what we know is that he has liver injury, and alcohol is not the cause here. He is obese and he has diabetes type 2, which means that he has insulin resistance. In addition to this, his liver injury caused right upper quadrant discomfort and hepatomegaly, probably due to the inflammation. Obesity, diabetes type 2 and liver injury tell us that most likely he has non-alcoholic steatohepatitis. Recall that the hallmark of non-alcoholic steatohepatitis is elevation of liver enzymes, with elevation of ALT higher than elevation of AST, but typically they should be elevated no more than 200 units, and this mild elevation of liver enzymes should be present in a patient with features of metabolic syndrome. It can be elevation of liver enzymes in patients with obesity, diabetes or dyslipidemia. But the question asks us how obesity and diabetes type 2 lead to liver injury. Recall that in our body we have adipose tissue which consists of triacylglycerols. Diabetes type 2, which is caused by insulin resistance due to the obesity, stimulates lipolysis of adipose tissue. Lipolysis results in the release of free fatty acids into the blood. These free fatty acids are going into the liver, where they begin to accumulate in form of triacylglycerols, and progressive deposition of triacylglycerols with time cause hepatic steatosis. The problem with fat tissue is that it can release pro-inflammatory cytokines, which with time cause inflammation with liver injury, and the state when fat tissue cause inflammation inside the liver we call non-alcoholic steatohepatitis. So the right answer here is lipotoxicity due to the insulin resistance. Autoimmune-mediated hepatocyte destruction is the right answer for autoimmune hepatitis, but there are no autoimmune markers. Viral infection of hepatocytes is not correct simply because viral tests are all negative. Toxic injury from medication will be the correct option for drug-induced liver injury, but in this case, the ALT and AST elevations are significantly higher. Sometimes they can even reach 1000 units. Excessive alcohol consumption is not correct, because in case of alcoholic hepatitis, the elevation of AST should be higher than elevation of ALT.